It's a little after
Okay.
4:30 now. We're
Okay.
going to go for about a half hour here, guys. And the first 10 minutes or so, we're going to be doing a lot of talking, unfortunately. But I promise we will get active and we will move. Because that's the point of these sessions that we're doing, is to get you guys to moving so that you guys can live better. And that's the name of our program. So welcome, guys. Thank you guys for joining us. My name is Raul Lona. In case I haven't met some of you guys, some of these faces I remember from the past, and I apologize if I don't remember you exactly by name, although I'm cheating because I can see your name on the screen. So welcome to our our first therapist-led session on our Move Better to Live Better program. Hopefully some of you guys were able to take our Pilates classes that started last week. We had a yoga class that started last week as well. And they will be ongoing at least for the next 4 weeks, and maybe even further beyond that, depending on how it goes and depending on how people do with this isolation during this COVID crisis. First, I want to welcome you guys.
You're welcome to come down.
Are all this your email distribution list for the Pilates classes? I'm sorry to interrupt. I just wanted to make sure.
Say it again. I'm sorry, Wendy.
Are all of this on your email list for the Pilates classes? Because I've been getting these M3 physical therapy emails. Are those also including, is that the same distribution list for Pilates and whatnot?
Yes, they should be there. They're doing Pilates twice a week now. And just so you guys are aware, our classes are progressive. We're starting out kind of light. So this may be a review for a lot of you guys, may be too easy, but you needed to start at a certain baseline level and it will build from here. But I wanted to give you some information. I am a physical therapist, so I would be remiss if I didn't talk a little bit about anatomy before I got you guys moving, because I deal with injury. So I want to make sure that this movement that we're going to do isn't going to cause any further injury. Okay, an exercise that we do isn't going to cause any further injury. So again, the classes will be very progressive. They'll start with a lot of anatomical terms, a lot of stuff that you guys can do on your own. Hopefully you guys can practice some of this, and we will post this video for you guys on our website coming soon. We're working on that right now. And that way you guys can look back and reference in case you guys have questions. If all else fails, you guys can always email me. On our website is my email. It's raullona@m3pt.com. Okay, so let's go ahead and get started here. The purpose or the topic of my presentation today is the hip as it relates to the back. They relate amongst each other, and I call it kind of the big sister, little sister relationship, in that the big sister is the lower back and the little sister is the hip. And I have two girls at home. One's 14 and one is 10, and they're always going back and forth with each other. When the little sister, the hip, gets irritated or her mood is not right, she always seems to irritate the older sister who lives right next door, and in this case they share a room. So when one thing is not going well with one little sister or one sister, it always tends to affect the other and vice versa. So I want to show today the relationship with the muscles, the range of motion, the alignment, and the mechanics of the hip or the little sister, and how it can affect the lower back, which is the big sister. So hopefully that reference or that analogy kind of makes sense to you guys, but I needed to throw something in there to kind of simplify it for you guys. First, I wanted to kind of be, a little bit, talk a little bit about some of the big uglies that we want to talk about when we talk about lower back and hip pain. Things that you want to watch out for to make sure that we are not dealing with anything, the big uglies as we call them. If you're having lower back pain or hip pain related to a fall that you just had and you have not had an x-ray, you want to make sure you clear that. Want to make sure we don't have any fractures in the room. Also want to make sure if you've had a recent infection and you all of a sudden started having this really bad back pain or hip pain, you want to make sure we clear that with your doctor so no infections. And then also consider that sometimes organs in your body, your stomach, your pancreas, your bladder can also contribute to back pain. So we want to make sure that those are all clear before we feel confident that this is an issue or back pain, or hip pain that can be treated with exercise, with physical therapy. Okay, with that being said, again, this course is going to be geared toward exercises related to the back and the hip and how they relate to each other. But first, we want to talk about the acute patients, because I already heard one person say that they have acute sciatica right now and they're not sure what to do with it. I've had several calls from people during this COVID isolation, from people that said, I can't move, I've been at home, I don't know what to do, I don't want to take any opioids. my doctor won't see me. They can only see me over FaceTime, or and I need some strategies on how to make this better so that I can get back to moving or exercises. So we're going to be going over some of that today. The first one I want to talk about is if you are a patient with at least 50 candles on your birthday, you may have an issue with stenosis or arthritis, okay? If you're having back pain as well as leg pain down the leg. Those people have an arthritic problem in their spine where the spaces in these vertebrae are decreased. It's flattened out. These discs have flattened out, and now you have an issue where there's not enough space for these nerves, which are these yellow things, to run down the leg. And when this nerve is impinged, it's going to give you sciatica. So that's the arthritis people, okay? Some people who are a little younger, between the ages of 20 and 40, 45, around my age, have a disc problem. And the disc is the donut-shaped spacer in between the vertebra. And the purpose of the disc is to create cushion and to create space. When that disc gets injured, either through a bending, lifting, or any kind of twist injury, that disc bulges out and it presses again on that nerve that goes down the leg, creating either pain locally at the lower back or even sometimes down the leg, okay? Then we have the other category, which is very prevalent, is the muscle strain. If I turn the spine around, so you're looking at the spine's back, you got muscles that cover on either end of the spine that go all the way into the gluteal area. Commonly, a back issue or back pain or hip pain is commonly a muscle strain, little micro tears in these muscles of the spine. So we're going to be dealing with all these issues today, and how to better position yourself and how to ameliorate any kind of pain that you're having that's not allowing you to move or exercise, okay? The other category, which I won't talk too much about, is a sacroiliac joint problem, and that's pain right in this joint here. If you have pain right above the gluteal on one side that's painful when you walk or when you put pressure on your leg, likely that's your sacroiliac joint, and we have certain ways to deal with that as well, okay? So first, I want to talk about each one of the injuries we just talked about and how, if you're having an issue with one of them, how you can position yourself or do certain exercises or movement to give you some alleviation, okay? Okay, so I'm gonna have my assistant come up with me here and demonstrate with us. So what you need, if you wanna follow along with me, you can, if you're in position to do these exercises with me. I'm gonna tilt the camera down a bit so that we can see our lovely assistant, Amanda, here. Say hi, Amanda.
Hey, everybody.
So let's first talk about, if you're having an issue with lower back pain, with leg pain, and you're over the age of 50, likely it's going to be some kind of arthritic, stenosis,